Can you start the live stream, please, for the IJB meeting, please?
Okay, good afternoon everyone and welcome to this Angus Integration Joint Board Committee. Welcome to the hybrid meeting of the Integrated Joint Board. I would remind all attendees that this meeting is being recorded and webcast live on the Council's YouTube channel. I have agreed the attendance of some members remotely and would remind all remote attendees to mute their microphones when not speaking. For any members of the public watching, please note that all the public committee reports, including details of specific recommendations, are available on the Council's website. Before we move to the agenda, we have a deputation request submitted from Kathleen Blythe and Irene in relation to item 8. Are we happy to agree to hear this deputation? Yep, thank you. Excellent, thank you. And that moves us on to item 1, apologies.
Convenient Chair, there's no apologies today.
Okay, thank you. Item 2, declarations of interest and statements of transparency. Do we have any? Nope. Thank you. That moves us on to item 3A, the minute of the previous meeting. Are we happy to approve as a correct record? Yep. Okay, thank you. No, Andrew.
Sorry, Chair. Thank you. It was just on the item on unscheduled care and the Scottish Government funding. Just the minute reflects that I raised concerns about GP workload. The key point that I was trying to make was the fact that it's actually the impact on the existing primary care team as a whole and the integration with that team rather than necessarily workload on any specific team.
Okay, we will get that reflected for you, Andrew. Thank you. Okay, that takes us on to item 3B, the action log from the Integration Joint Board. Any comments? I've just got one quick question, which is in relation to the final item, the strategic financial plan. We're now looking at December 25, and it was just really to get assurance that that's still going to be coming to the December committee.
Yes, Chair. I think I briefly reflect on this point in our in the finance report. But yes, the intention is that we will still bring a further update to the December 25 meeting. At some point, if this issue doesn't get progressed as far as we would hope it would in terms of bringing forward proposals, it will eventually become part of the next iteration of our strategic financial plan. But it obviously won't go away if we don't manage to resolve it.
Thanks, Andy. Okay, so item 3C, the Chair's assurance report. Do you agree to note the report in the draft minute, or is there any questions, comments? Yes, Sandy.
Chair, can I let you see if there's any other comments first before I come in? Okay, well, in that case, thanks, Chair. This item 3C is a Chair's assurance report about the Audit Committee. I'd just like to bring members briefly up to date about an Audit Committee that's happened this morning. This morning we had a special meeting of the Audit Committee, so out with our scheduled meetings. That meeting was specifically to review the proposed IJB's annual accounts for 24-25 and also the output of the external auditor's audit process in terms of their annual audit report for the IJB. That meeting has gone smoothly. The auditor's report and the annual accounts were both accepted and are now being signed off, may have already been signed off, but are now being signed off to conclude that process. So that is helpful. It's maybe worth me sharing because it provides some context for other conversations in the IJB. The auditors, our external auditors, made one recommendation. It's all available in this morning's papers. And that was, in terms of their single recommendation to us, the board does still need to prioritise the identification and delivery of savings and planned interventions to ensure our future financial sustainability. And we all know that that equates to our continued ability to deliver the strategic financial plan and sustain our services. So that's not new news to us, and I said that to the auditors. They're already conscious of that and working towards that, but they obviously, as their point, that they are keen that they were able to emphasise that's the one that they chose to make. So otherwise, that meeting this morning, grateful for everybody who attended, was able to sign off the accounts, Chair. Thank you.
Thanks for that, Sandy, and I was there as an observer, and a really positive report, to be fair, from the auditors. As you say, one recommendation that I think we probably all could have written, to be fair. So thanks to you and all the team for all the hard work that goes into pulling the accounts together. I know how much of the year that takes up, so well done. Yes, Martin.
No, start from the beginning. It's actually on the update of the IJB scheme of delegation. No, the review of information government strategy, where you're saying that the documentation is consistent with Angus Council processes and procedures for information governance. Is there an implication on the processes for the other partner?
Thanks, Martin. I'm going to see if Morgan would like to come in, because she's probably a wee bit closer to this work, if that's okay, Chair. Thanks.
Yes, so we do have our own documentation currently for the partnership, but that's in relation to Angus Council data. We already follow the processes for NHS Tayside, so what we're doing is, instead of hosting our own documentation in the partnership, we're moving that for Angus Council data, we're moving that in line with Angus Council's policies. So absolutely, we still take into consideration the NHS Tayside process, but we just want to make sure we're also following the Angus Council process correctly.
Okay, thank you. Item 3D now, the Chair's Assurance Report for Clinical Care and Professional Governance. Questions? Yep, sorry, Alison.
Thank you, Chair. The Clinical Care and Professional Governance meeting continues to meet monthly. There has been some reconfiguration and realignment that allows us to fulfil the requirements of the Tayside Clinical Governance Strategy, and we are aligning social work standards with that to ensure that we have a quality management system approach. I won't repeat what's in the paper, but happy to answer any questions. Thank you.
Questions, comments? Nope. Happy to note. Excellent. Thank you. That takes us on to item 3E, Chair's Assurance Report, Strategic Planning Group. And I think, is that yourself, Sandy?
Yeah, Chair, I did chair the last meeting of the Strategic Planning Group. Hopefully the paper is relatively self-explanatory. We've just set out what we have covered here, and the decisions taken by the Strategic Planning Group, and there's minutes of previous meetings attached as well. So I'm happy to take any questions.
Any questions? I've got a quick question, just in terms of paragraph 4.2, where it talks about the risks and the current and planned controls that are effectively trying to reduce the risk. And I just wondered if the controls or the processes in place to move to the planned risk levels, are they working, I suppose, is my question.
Yeah, thank you, Chair. I think in terms of the review of all of our risks to the IJB and indeed our operational risks, we do manage and monitor the performance and the progress around the mitigating actions as part of our care clinical and professional governance meeting. But members will be happy to know that we are going to be looking to explore our risk appetite and planned scores again as an IJB for the strategic risks in the coming year.
And then just in terms of paragraph 5.1, where it talks about strategic delivery plan update, there's only limited assurance that was noted, and I wondered just what sort of work was kind of being done to try and increase that level of assurance.
Chair, my recollection, and others might be able to correct me if I've got this wrong, that was probably about some of the progress with some of our planned interventions, which is the delivery aspect, the delivery of change or savings after we've identified them. And I think that was the reason that we were struggling to give ourselves more than limited assurance, because that's so pivotal to our ongoing sustainability. We obviously report on where we are with delivering those planned interventions quite regularly, and as a management team we're continuing to focus on them. Later on, actually, in the finance report, I'm not going to steal the thunder of the finance report, but the finance report will just kind of highlight, we're going to try and change the way we report some of that progress regarding planned interventions.
Thank you, Sandy. Just a final question from me. I mean, I know the recruitment's been quite difficult, but under, I think it's page 43, the Flow Commission, it's additional funding for, I think it was about 7 posts or something. I just wondered where we were in terms of recruitment and if it was kind of going well.
Yeah, I'm happy to take that one, Chair. Yes, the progress in terms of the recruitment around the posts aligned to the urgent and unscheduled commission is going well. We are anticipating appointments being made before the end of November.
Excellent, thank you. Happy to note that report, yep. Okay, thank you. That moves us on to item 4, the Chief Officer update, and I think that's yourself, Jill.
Yeah, thank you, Chair. Members will have the Chief Officer update in front of them. I'm not going to pull out anything specific this time. If anybody does have any comments or questions on the report itself, then happy to take those questions.
Lewis?
Thank you, Chair. It was just in relation to unmet need. Obviously, this is a kind of an ongoing item on the agenda and features kind of within our reports, and I just wondered what we're doing to continue to monitor on that, because it continues to be a worrying picture, and the numbers are going up in terms of the amount of people as well as maybe the hours staying the same. Could I get an update on that, please?
Absolutely, and I'll bring John in to provide a level of detail around that, Lois. But what I would propose is that we can provide you with some of that information out with the meeting as well, and perhaps pick it up at our next liaison meeting. But I'll hand over to John as well.
Thanks, Jill. Yeah, Lois, it's we report on a weekly basis in terms of what the unmet need level is in Angus, so we're always acutely aware of any kind of trends or patterns emerging. What I would say is that we have seen numbers higher at certain points. We're probably reaching I would say a threshold at this moment in time where we're seeing, as you rightly said, hours remaining comparatively similar, but actually the numbers of individuals potentially a wee bit lower, so that's highlighting what we know to be individuals having greater need. So when they're in the community, we have care at home provision that is keeping individuals at home for longer, which is good, but it does mean that often those packages of care required to do that need to be more significant, and at points in times that could be challenging to provide. So as Jill said, happy to provide. I mean, there's a lot of data sets that we produce, which includes some of the data that we cover within the Chief Officer's report. So if there are areas that you would like more information on, very happy to provide that, because we do have an awful lot of data to show in that case.
Yeah, I think I'm actually wondering if in the next report we can put a bit of a chart over time so that all members are aware of that as well, similar to what we did for the delays in transfer of care a couple of months ago, and we can put a chart in so that members can see how it's tracking over time, as well as providing that additional information out with.
That would be really helpful, thank you. Yeah, thanks.
David.
Thank you. Related to that, I'm pleased to see that there is a reference to the number of users in respite beds, following my request for that to be included. However, after having made that request, I was asked what would the format of that information be to be helpful, and I had suggested that information regarding the number of respite beds that were available, the number of people using them, and number of episodes, and to build up a picture. And then that could periodically, as you've just described in an infographic, be included to that. The reference to 27 service users in respite doesn't actually mean anything to me. It doesn't tell me if that's is that the number of people who are in respite on a given day. I'm aware that there aren't 27 dedicated respite beds that I'm aware of. So these people, if they're there, they've been accommodated elsewhere. Nor does it give a clear picture whether that's over 65s or under 65s. So if we can now that we've found a way to get to the information, if we can build up that picture, then that would be helpful. Thank you. Can I just? I'll give you my second question. The 3.9, the National Transition Strategy that's referred to there, which I think is great. My question is there a consideration to developing an implementation plan in response to that? And it may be too early to ask for a time frame and engagement around that, but I will anyway. Thank you.
Yeah, thank you, Dave. So in response to your first question, we've got our interim annual performance report, so our half-yearly report coming to the IJB in the next couple of months, so we can add a bit of information around the specifics for that, the care home beds into that, absolutely, and we can share that information with you in advance. In relation to the transitions, it's obviously something that's quite newly published, so we will be considering that as an exec team in terms of what is the next steps around that piece of work that we need to do, and we have had some discussions around considering bringing that back as a full paper to IJB.
So we will hear back in due course whenever. I have no notion of what the scale of this is. So.
Any other questions, comments? I've got a couple of things. Just to clarify, paragraphs 3.72 and 3.73, should they actually read as paragraphs 3.62 and 3? I think they refer more to the independent review of inspection rather than the Scottish Health Reports. So maybe just somebody's inserted a paragraph. Is that right? Yeah. And obviously the paragraph 3.71, just like to offer congratulations to Doug Fairweather being named finalist in the Scottish Health Awards, to congratulate him and wish him every success. So hopefully we'll hear a successful story there. But actually my only kind of real question was around the palliative care. Have we got any date when this is likely to be presented, or do we have a time frame for that at the moment?
So we will confirm the time frame around the palliative care. That's work that is being progressed by Dundee IJB as the lead partner for the palliative care strategy, and obviously there is work underway, so we'll confirm the timelines, but we will be aiming to bring something back to the IJB probably early 26.
Excellent, thanks Jill. Are we happy to agree to note the update provided? Oh, sorry, Martin.
Yeah, just under 3.9.1, in this national transition to adulthood strategy, is there any finance associated going forward with that? Because obviously the education up to then they go into adulthood and the finances ceases.
So that will be very much part of our scoping work, Martin, in terms of looking at what the implications for the health and social care partnership is in response to that. Kirsty, I don't know if you want to add any.
No, I think you're right. It's too soon to give any comment on that. It's about scoping the needs.
Okay, thank you. Happy to note the update provided within the report. Yep, excellent. And thanks, Jill, to you and all the team for all the work goes into that report. Really informative. Okay, that moves us on to item 5, which is our spotlight session for this committee in what matters to you. And is that yourself, Eunice?
It is, thank you. I think first of all we're going to watch a small video, short video. Thank you.
The focus of Angus Health and Social Care Partnership has always been on ensuring that the needs, aspirations and well-being of our community are met. As we strive to support people in Angus to enjoy physical and mental health to their full potential, it's really important that we understand what matters to each and every person. To help us do that, we invited Tommy Whitelaw, the Health and Social Care Alliance Scotland's national lead for person-centred voices, to come on tour of Angus and meet as many people as possible who deliver health and social care support. Tommy's transformative work has created a blueprint for embedding compassion, active listening, intelligent kindness and a what matters to you approach. I'm delighted to say that over 850 people have heard Tommy's inspirational talk during 65 events across 37 different venues.
Over the last 12 months, while we've been on our Tommy tour of Angus, we've had time to reflect on the fact that we're really good at carrying out assessments with people, and these tend to sometimes focus on what's the matter with you. If we're going to be truly person-centred, we really need to ask the really important question of what matters to you.
This tour across Angus over the last year has celebrated the beauty of partnership working between ourselves, the Health and Social Care Alliance Scotland, Angus Health and Social Care Partnership. The beauty of Angus has only been matched by the beauty of the incredible people we've met over the last year. To really embed this what matters to you way of working together or delivering advice, support or care.
We're keen to have a wellbeing tree or a what matters to you tree in the day room in each ward. It has been very positive. We've had lots of positive feedback since the sessions. Staff have felt very emotional, but also very empowered.
We have a tree in our hallway, and that belongs very much to the men and women who attend the service. The trees have come about through the ambassadors and the teams, the staff teams following the meetings. So we really feel very proud of them and encouraging not only our colleagues but the men and women who use our service to be able to say how they feel on that day, or to tell us what makes them happy and what we can do to make their day better.
Anyone wants to be heard, and I think this is an outlet for that. It opens up whole different ways of communicating. You learn, like I can plan an activity around something I know really matters to somebody.
It could be about the meaningful activities, hobbies, interests, it can be anything at all. So really at a glance, when anybody goes in to that room, you know, they can see and they can tailor their approach, they can tailor their conversations, and it really enriches the conversations and the relationships that people have. And what it really means is that we provide truly person-centred care.
The feedback that we've received from everybody who's attended a Tommy workshop has been incredible, and I know that it's made a lasting impression on so many people. We've developed a number of resources, and we're really encouraging people to have a what matters to you tree in the areas that they work. Have a proud cloud, create a proud cloud to really celebrate successes within the teams. Although our work with Tommy is coming to an end, I know that our 64 What Matters to You ambassadors will continue this good work, and it will continue to grow from strength to strength.
Thank you, and yet again, I think I say this every time, I think these videos really actually bring a lot of the stuff that we read on paper to real life, and you actually get a real sense of what it actually does and how it impacts on people's lives. Have we got any comments or views or anything from anybody? Yep, Lewis.
Thanks, Chair. Yeah, I just wondered what will be done to kind of monitor going forward the impact of that piece of work, just so that you're able to demonstrate that it actually does make a kind of lasting difference. Thank you.
Yeah, absolutely. So obviously in terms of monitoring the outcomes of that, and I think we need to be clear that this is just one part of a bigger piece of work that we're doing to support staff wellbeing across the partnership. So we will be routinely looking at, as we always do, around our levels of sickness absence, our turnover, which I know that Eunice will pick up as part of the discussion around workforce. But what we have seen recently is a reduction in our sickness absence. We've also seen a reduction in our complaints from the areas where Tommy has had sessions with the staff groups in specific areas. So that's just a couple of examples of kind of some indicators that we will be using. Obviously the ambassadors are out there to continue the work, and through the work groups from the subgroups of the workforce steering group, we'll be continuing to monitor that.
Okay. Excellent. Thank you for that, Eunice. That was really informative. That moves us on to item 6, the workforce plan, which is back to yourself again.
Thank you, Chair. I'm very pleased today to bring the workforce plan for consideration, and this will be the plan from 2025 until 2029. We've increased the timescales by 1 year so that we're aligned with our strategic commissioning plan. Today, I'm looking for members to acknowledge the progress that we have made on the plan from 2022 to 2025 and recognise there's been a significant amount of work and energy put into supporting our workforce in the Health and Social Care Partnership. Looking for approval for our new plan and also seeking substantial assurance on the delivery of the previous plan, given all the work and the successes that we've had, which have been outlined in the report. I'm also looking to agree frequency of future assurance reports. The report's obviously really quite detailed, but some highlights that I would want to just draw to your attention is that over the last 3 years, we have been able to, through a sustained and sort of modern recruitment campaign, we have worked closely with our social care providers, and we have got an extra 120 new care home staff currently working within Angus. We have focused on youth employability and volunteering initiatives. We've used the use of the long-term unemployed scheme. We've developed a succession planning framework. We have concentrated on GP and newly graduated nurse recruitment, and that's been strengthened. And we have been working with our workforce data set, which has been created, and it's not been without its challenges to get a data set across both partner organisations. And that's just some of the highlights. A lot of them are laid out within the report. You'll hopefully notice in the plan we are trying to sort of refocus what we're going to be concentrating on over the next year, and that's really in line with the work that's been done around looking obviously at our national requirements and our strategic priorities, but also what data is telling us. So in line with the data, how do we then ensure that we have a workforce fit for the future? So we've looked at, and it's outlined in the report, population data and workforce data. So as a result of that, we are trying to move the focus, which is still will be on recruitment, but it's really on retention and how we can make sure that we can retain the staff that we have and develop our workforce, from young people coming into our workforce and right through with lots of opportunities. So our focus will be on retention, staff wellbeing, as has already been noted, and in line with our data. So if the report is approved today, we've got a workforce steering group which oversees the workforce plan. We're meeting again on Tuesday, and at that point then we will focus on our work streams and look at how we can make sure that our work streams are aligned with our plan and how we want to take matters forward. I would also just want to say thank you very much to Morgan Lowe, who has worked very closely on this workforce plan and has driven a lot of this work forward. Just to acknowledge that. I'm happy to take any questions. Thank you.
Thanks, Eunice. Yes, Sam.
Eunice, thanks for the report. Just in 5.61, with a focus on staff health and wellbeing and NHS Fair Scotland and absence for NHS employees, is there something similar for council employees?
put it on and off. Yes, there is. So it's how we gather the data and the data that's available. So we are working with our Angus Council colleagues around that. Angus Council are coming to observe our absence information meetings in order to try and see if we can share best practice and work closely across both bodies. So we very much work closely with both HR services who are also part of our workforce steering group. Thank you.
Yep, Chris.
Yeah, thanks. Just a couple of points just to raise on the workforce plan, Eunice. Section 5.6 is a question I've asked before, but I think with a document of this gravity and importance, the next 4 years.
I think there is the right card, but they.
Hi there.
Sorry, section 5.6 refers to a range of targeted activities around recruitment. And I've asked this before, but I think with a document of this gravity and importance, it might have been, with on hindsight reflection, useful to have some detail on what those targeted activities actually were, how they worked, what they were, how they were structured. And obviously you're noting that there was an increase of 120 staff as a result of those initiatives, but it'd be helpful to know what those initiatives actually were in the context of the workforce plan. I'll maybe go from my other two and then take them all at once, Eunice, or do you want to put to you?
I'll just respond if you don't mind just as I go. So some of that is outlined in the workforce plan, and that we've done recruitment fairs, career fairs, we've worked with colleges and universities, we have done a recruitment campaign in terms of developing videos. So that's all been part of the work that we've done to try, and we're working very closely with our providers as well. So there's been a range of activities which hopefully you'll see if you look at the plan again that's outlined in that, and that's really what's had our success. And we're building on that as well, so that will continue as we go forward.
Okay, thanks. The second point was around section 8.11, which was around there was talk about staff turnover, but it said it wasn't possible to calculate staff turnover for Angus Council employed staff at this time. Is there any reason for that if the NHS has been able to produce that?
I think it's a different system that is how record the Angus Council use Resource Link, and I think it's how things are recorded, and that is different from the NHS, and that's where the challenges is. So on a service level, obviously we know what the turnover is, but it's taking a sort of wider approach to that. But as I say, we are working closely with Angus Council colleagues. They sit on the data subgroup, and hopefully these things can progress over time.
Okay, thanks. So just one final point in regard to Appendix 3 in the action plan. It refers to, on one of the 5 pillars, which was attract. It's talked about recruitment, retention and workforce data again, and talks about ensuring a joined up approach. And I know it's a wide-ranging description of an approach, but perhaps some detail on what that joined up is, who with, how, what, etc.
Okay, thank you. So we have a recruitment and retention subgroup that has a range of people on that, including well, I'll maybe ask Morgan to speak exactly who's all involved in it, because I'm thinking HR are involved in it, but I know, yes, they are. And we've got our third sector rep on that, and we link, as I say, with schools and universities, and that's how we have a joined up approach. So what can we do across different parts of services, but also, for example, around the newly graduated practitioners, we work with NHS Tayside around that. Grow your own social workers, we work with children and families and justice around that. So that's where we have our joined up approaches. So we're not duplicating effort, but we're working collaboratively together. Thank you.
Yep, I've got Kirsty, and then I think I've got Alison.
Me next. Okay. Yeah, thank you very much. So Eunice and Morgan and others, I was really pleased to see the report. I think it's very informative. It is detailed, but it's thorough and a really clear data and evidence basis. So I think it's really helpful, and I think perhaps we can take some of that learning into some of our workforce planning for my own services. So thank you for that. In terms of retention, just a couple of points. I noticed at the bottom of page 84, you're highlighting some barriers around social workers and system and digital tools. So just wondered kind of specifically what that might relate to, and whether that's specific around the partnership or it's broader. And also, We do need to understand our levers data more fully, and I think that's an issue for our systems in Angus Council. But Eunice, I wondered if you had any sort of sense around levers data, why we're losing people from the service, if there are any particular points that we would be looking to address. Thank you.
Thank you. So in terms of some frustrations around digital tools, I think some of our systems are quite cumbersome. I think there are frustrations around the information management system that we use across the partnership and the council. And some of it is just not as modern as it may want to be. And that's always something that we've got a real focus on. We've got a digital group within the partnership. We're working with the Angus Council colleagues and trying to make things more efficient. We've brought in magic notes to try and support that, but that's some of the feedback that we've had. In terms of levers information, I think that's slightly more tricky because we don't have a coordinated approach with that across the council. For example, NHS, we do get copies of the exit interviews, which is only a small snapshot of what it's only if people choose to do an exit interview is that we would actually get to see a copy of it. But it's something we're conscious of, and it's something that we are trying to work on to make sure that when people are leaving that we can engage in these discussions. And we have engaged with the Angus Council HR about exit interviews and how we can make sure that we can get relevant feedback. So hopefully that helps answer. Thank you.
Thank you. Alison?
So thank you, Eunice, and you know that I'm a big supporter of the workforce plans, both the one that you're asking for substantial assurance for and this future plan. I just wanted to highlight around the recruitment and retention. So the last plan was really focused around recruitment. This one's around retention, and I welcome the alignment with the strategic plan delivery and that it's data driven. I do think for me the action around reviewing professional leadership across Angus Health and Social Care Partnership, as it is recognised that strong professional leadership is a factor in supporting staff retention. I'm really keen to get behind and support that group. I think that's key for us, not just on staff retention, but also in ensuring we have that, you've got the data of what workforce you have and how you recruit, but what workforce we need in the future. So I'm really keen that we think strategically around our new models of care, the population health framework, Tayside model of care, and getting that professional leadership right so that we're not just delivering, keeping and retaining what we've got now. We need to be thinking of the future, and that's across all our professions. I'm not talking about doctors or clinical professions, across all our professions, because for me it's not just about having a workforce, it's about having the future workforce and the new different ways working with our partners in leisure, social work, social care. Thank you.
Thank you, Alison. I think we do value all employees that work across the Health and Social Care Partnership, and I think you're right that we do need to make sure that we have good succession planning. We're developing our young workforce, developing our professional workforce. We're looking right across all the different contributors that make up the Health and Social Care Partnership. We've got our succession planning framework, and I'm really keen that we grow our young workforce, because when we look at our population data, we know that we have got a real challenge, particularly in Angus, around the number of young people coming through. So it's how we make sure that the Health and Social Care Partnerships are an attractive place to work, that there are good career prospects for people, that people are valued and well looked after. And that's all what we're trying to do around the sort of retention agenda that we're going to try and drive forward in the next 4 years. Thank you.
Sorry, Lois.
Yeah, thank you. Yeah, unfortunately, Angus's rates in terms of deprivation and poverty are pretty high. And one of the issues in terms of access into employment for many people is barriers to transport. And I just wondered what work has been done within the partnership in terms of recruitment and retention when it comes to transport, because that can be a huge barrier for people within the workforce, as well as the people that we support as well. Thank you.
Okay, thank you. So I think in terms of transport, what we have tried to do, particularly for our social care workforce, is work with our providers to look at one point we did provide electric cars. There's also the cycle scheme that we've got. So other ways of trying to support people who don't drive or have transport difficulties. We obviously have, fair recruitment processes, so people with disabilities, etc. The guaranteed interview scheme, etc. So there's lots of different things we are trying to do. But that's certainly something we can think about further. I'm not sure that has been, maybe we need a wider focus on that, and that's something we can certainly take back and discuss. But that's some of the things that we've done just over the last few years around transport issues. Thank you.
Yep. Jill, do you want to come in there as well?
Yeah, thank you. And I think just to build on what Eunice was saying, some of the conversations around the community planning partnership, around our involvement from a health and social care partnership and how we can support that employability. And obviously through the CPP there's representation from education as well as Skills Scotland, etc. So that's something that was literally just discussed last week around how we can take a more active role within community planning partnership and support the wider planning and employability.
Thanks for that. It's a good point you actually make, especially when you start thinking about young people and how do you get them into the workforce if they don't have access to transport. So I think it's a good point. Do you want to come back in?
If that's okay, very quickly. Yeah, I think it's, I've no doubt that there are bits of work that's been done in terms of looking at that, helping people get to interviews. But I think unless we really drill down and understand what the barriers are, but also continue to follow that work up as well, then, quick kind of interventions can maybe have an impact for a small bit of time, but unless there's that ongoing support and ongoing work looking at this, yeah, we're not really going to kind of perhaps tackle it. And I know it's a big issue to tackle, and the partnership only have a bit of a part to play, but yeah, it would be good to see a little bit of information on the work that's been done, but then also a follow-up as well, perhaps, just so that we can kind of track that. Thank you.
Yes, happy to take that forward. Thank you.
Alison, you want to come back in?
Yeah, just I agree with you, Lois, but more thinking around if we can deliver as much care in our communities locally, with local employment opportunities and career progression in the communities, rather than people travelling, for example, to Ninewells and Dundee, that will surely help in terms of increasing employability. And that is absolutely something that we are endeavouring to do. It's not easy because we have to work across things that are under acute services, secondary care, being delivered in the community, and I'm thinking phlebotomy, ECGs, instead of travelling to Ninewells for an appointment. So there's an absolute commitment to that. Chris and I are part of the group looking at that, but also with partners, and very much working with our leisure colleagues. If we can deliver things locally, then we should, and that should surely help the workforce.
Yeah, I'm talking about locally. I mean, locally there are barriers to transport for people, even getting around their town or going from one town to the other. And I guess if you're in a job where you're perhaps doing house-to-house visits, providing care, absolutely, a bike might be the way to travel, and helping ensure that people can access into bike schemes would be one thing. But there's also the reality of, people aren't going to jump on their bike in the winter to try and get around Angus when the conditions are poor. But no, apologies if I wasn't clear. I mean locally there are barriers to transport. Our bus network isn't necessarily all linked and reliable, so that's an issue for a lot of people getting into work. And maybe not everybody's going to be fortunate to get a job in health and social care in their hometown. So they might have to travel. But yeah, no, my focus was on the issues within Angus. Thank you.
Thank you. Martin?
Thanks for the report. I found it really, really interesting. Just for clarification to make it easier for me, when it says return to pre-pandemic levels, what were the levels pre-pandemic? And is that the start point? What were the levels, and what was the success in recruiting and retention when they were at their levels? And then I've got another question just for...
Sorry, I'm just trying to find the bit in the report that you're referencing so I can look to see what I've said about that. So apologies. 6.3. So we've got the graph that's on, I'm not sure what page it is, but on the page after the 6.3 shows a rise, but I don't actually have exact figures. Yeah, so it's just saying that from what the information we've got, we're back to pre-pandemic rates in 2025. So that's the graph over the page. But in terms of what they were before, I'm not sure. Morgan, have you got anything you'd like to add to that? Sorry, thank you.
We can get that data, but we didn't really think it was relevant to go too far back. Really what the important thing to note is that we saw a surge in vacancies in Tayside post-pandemic. That has now settled back down. So we're not seeing the market being quite as hot in terms of vacancies at the moment. So that's kind of what we want to reflect, is that the rates appear to be back to that kind of normal rate that we would expect in Tayside. And we can obviously get that data for you if that would be helpful, but it's just to kind of explain why there was the surge in vacancies.
And just me being pedantic, that I want to know what the start point was and the figures were and the success rate, but it was just a personal thing that I was asking there. And second, 6.2, the lower paid occupation.
Okay, I'm going to ask Morgan to come. I don't know if we've actually got numbers. I think we've taken this from national information.
Yeah, we could provide that. So obviously we're just trying to kind of highlight the differences, and that covers lots of different sectors, but we could get the population for each of the areas and then calculate that. That's easy enough to do.
I always think in that when we put percentages, I want to know what does that mean, because you could have 3 people and that's a big percentage.
I suppose why we've tried to highlight with the percentages, it's just to show a sort of, a trend rather than the numbers. Cause it's difficult. We don't want to be comparing apples with pears, but because we've got a percentage, it just gives you the differences to try and highlight. But we can get that information and send it on to you, not a problem. Thank you.
Okay. Any more questions, comments? Are we happy to approve the recommendations per the report? Yep. Excellent, and thank you everyone for all the hard work that goes into that. It was quite a fascinating read and quite an achievement to get the next workforce report for 25 to 29, so well done. Thank you. That moves us on to item 7, the appointments report, and that's yourself, Jill.
Yeah, thank you, Chair. So just one appointment detailed in the appointments paper for today. So delighted that Grace is with us now and has been appointed as the Nurse Director for Angus Health and Social Care Partnership. So the report is just formally appointing Grace to the IJB in that role.
Okay, happy to approve and to welcome Jill. Congratulations. Okay, so that now takes us on to the section where we will hear the deputation for item 8, which we previously agreed. And just as a reminder, the deputation are allowed to speak for no more than 10 minutes, and members may only ask questions of the deputation at this stage and not to officers. So if we'd like to invite Kathleen and Irene up, and we can begin your deputation. Thank you.
Thank you all for allowing me to speak today. I'm here once again on behalf of the voluntary daycares, the 4 voluntary daycares in Angus. Some of you may remember our deputation in August 2023. We didn't expect to be back here today, but here we are, because we are deeply concerned about the daycare opportunities commissioning framework outlined in the report. We understand the need for strategic planning and sustainability,
but we must highlight some serious issues that have affected our ability to engage meaningfully. Lack of transparency around efficiency savings. We were unaware of the 100,000 efficiency saving approved in August 2024. The first mention of a potential 10% saving during a meeting we had with John Cooper on the 6th of August this year, specifically in relation to day opportunities. We were genuinely shocked when watching the most recent IJB meeting to realise that the decision had already been agreed a year earlier, without any open discussion, and that it only applied to the 4 daycare centres, not day opportunities. It's disappointing that the information wasn't shared with us. The lack of honesty has damaged trust and made forward planning significantly more difficult. Limited and reactive engagement. Since our deputation in 2023, we've only had 2 formal meetings with the partnership. These have lacked depth and co-design. Decisions were made without our input, and our feedback hasn't shaped the framework. Misrepresentation of VAA support. The report claims that VAA has supported us in developing business models. In truth, we initiated the contact, not the partnership. So far, sessions have focused on reviewing reports, not building financial strategies. We hope to move forward with Hayley and her team, but the support described has yet to be materialised. Feeling unheard. Despite our efforts, we don't feel heard. The framework doesn't reflect realities that we face: staffing pressures, rising costs, and increasing complexity of needs. Misleading data. We weren't involved in designing questionnaires on engagement sessions. We raised concerns about the inaccessible language used. The claim that only 2% of our work involves personal care is simply wrong. Our own analysis with VAA shows 64% of our service users require some level of personal care, and the numbers are rising. Attendance versus actual care. We reject that idea that our centres haven't recovered post-pandemic. We're busier than ever, but the needs are far more complex. We meet safer staffing legislation and provide high levels of support, yet decisions are being purely based on attendance numbers alone, without considering care intensity and needs. No data has been collected. Funding and efficiency cuts. Private contributions help, but don't cover the gap. The true cost of a place is far higher than the £47 we receive. No cuts have been made to the partnership's own daycare service. We ask for a funding breakdown and we've received nothing. We are not opposed to change. We are open to change. We want to evolve and we have evolved. But decisions must be based on facts and genuine collaboration, and this hasn't been our experience. The review process. We repeatedly told the partnership we were unhappy with the review process. No clear path was discussed. It felt like something done to us, not with us. We still don't have the outcome. Many questions remain unanswered. We didn't even know the review had concluded. Cost-cutting in disguise. We were told that this wasn't a cost-cutting exercise, but it clearly is. At the steering group on the 25th of November 2022, it was minted that no additional funding would be made available. The plan was to protect the current provision and reduce the numbers funded, not the payments. This never happened. Instead, we faced cuts without clear clarity or protection. Self-funding inequality. Self-funding helps some, but it's not sustainable. We're not profit-making. What happens to those people that can't afford it? Do they not deserve the care? Carers' respite has been overlooked. There's been no recognition for carers' respite that we provide. It's vital, yet no data has been collected on its impact. Outdated contracts. Our funding is based on a contract from the year 2000. The partnership can't provide a breakdown. How can they claim this as saving when they don't know the true cost of care and what they're actually paying for? We remain committed to working collaboratively with the partnership and VAA to ensure high-quality, sustainable daycare provision in Angus. We remain committed to collaboration, but we respectfully request a pause on the efficiency savings until true transparent review is done with provider input, a co-produced roadmap for business model with tailored support from VAA and other partners, more frequent structured engagement with daycare providers as equal partners, a clear distinction between day opportunities and registered daycare centres, recognising the different levels of care, regulation and staffing complexities. These are not interchangeable services and must be treated accordingly. The name matters. It reflects the dignity and depth of what we do. We are asking for honesty. We are asking for transparency. We are asking for genuine partnership. Please listen, not just to the reports, but to the people who work this every day. In summary, we have faced a process marked by limited engagement, unclear communications, and decisions made without transparency. Despite our efforts to contribute constructively, we've been left with unanswered questions, misinterpreted data, and a framework that doesn't reflect the realities of our service. We believe this can and must be improved through genuine partnership working. Thank you very much for listening to me today.
Thank you, and I know how difficult it can be to speak publicly in front of everybody. I actually thought you spoke very well, so really well done. Thank you for that. Have we got any questions for the deputations? Lois.
Yeah, thank you. Thank you for telling us what matters to you, and it's very clear that this has been a very difficult process and experience. I just wondered if you could tell us what impact, if this report was to go ahead, would have on your services and ultimately the people that you support.
Well, I think a £25,000 cut per centre would have a huge impact, possibly even closing our doors. As Kathleen said, we're not for profit, so we don't make a profit. You know, we just survive on what we get from the council. The private places subsidise us a little bit, but that's not sustainable for us. It would have a huge impact. What would happen to all the people that come through our doors? What would happen to the carers who basically, we are really there for respite, you know, so it would have a huge impact on, yeah, lots of things.
A lot of people.
Yep.
Thank you.
George.
Thank you, Chair. I've listened to what you said about the meetings. I'm reading the report at Appendix 1, and I'm counting about 5 meetings between VAA and yourselves. Is that incorrect?
We've had meetings with VAA, but it's been a lot to do with an analysis of what the partnership have gathered and the misinformation that they've done. It's the meetings with the partnership that we've had only 2 this year.
Martin.
Thank you very much for your report. You talk about misrepresented data. By whom? And you talk about honesty about 3 or 4 times. Honesty by whom?
Honesty by the partnership, because they collected data through the review, which is one point where they said that we only deliver 2% of personal care through our daycare centres, which in fact, when we did our own analysis with VAA, was 64% at that time. So it's misrepresenting. They're saying we're only doing 2% personal care throughout daycare centres in Angus, which is untrue. So it's misrepresenting data.
Any other questions? I've just got one question. You were talking about the cost, £47 and not being the true cost. What is the true cost if it's not £47?
At this point, nobody has actually calculated that, but we reckon it's in the region of about £90 to £100.
Any other questions? Nope. Okay, well, thank you very much. And as I say, I know how difficult it can be, but well done. Thank you. My proposal now is to have a 15-minute recess, and we'll convene at 3:15. Yep, thank you.
For IJB, please.
Okay, welcome back everyone. We now move on to item 8 on the agenda, which is the Daycare and Day Opportunities Commissioning Framework. And I'll hand over to, is it yourself, John?
It is, Chair. Thank you. Good afternoon, everyone. So IJB will recall that this paper was previously at IJB in August this year. That was report 6625. And as advised at the last IJB, the purpose of the report was to ensure that we have a commissioning framework in place to deliver daycare and day opportunities in Angus, and that the proposed mechanism for this is to use the interim market facilitation statement as per all other commissioned services within Angus, as described and approved by IJB in report 3025. Purpose of doing this is to align all tendering, procurement and commissioning to the current and future strategic commissioning plan for Angus. And the market facilitation statement is also proposed as a mitigating action within the risk management section of today's report, which members will see, enabling efficiency targets to be met whilst also monitoring outcomes against our strategic commissioning plan, and also supporting sustainability planning with day care providers. I'll bring Morgan in at this point, if that's okay, Chair, just in terms of explaining the market facilitation statement plan process. Thank you.
So just to clarify, we are proposing that we are no longer going to progress with the day opportunities framework. We're moving to an equitable approach using the market facilitation approach, which is what we do for all community care. So everything we commission. So we will not be using the data previously mentioned. This is starting afresh. This is really a new process. So work will begin to calculate the current cost of delivering daycare, and also working to identify current and projected future demand for daycare as well. And with regards to the saving, while the proposed saving forms part of our overall strategic financial plan, it is still notional, and obviously the work that we're about to undertake will determine whether or not we can deliver on that. So just...
Thank you, Morgan. Thank you, Chair. And as has been highlighted within the deputation as well this afternoon, a lot of what our plans are how we can do this collaboratively together. And you, as an IJB, raised concerns at the last IJB meeting in terms of actually understanding what some of the data would mean, and also what the future plans are. So we have had several meetings. We've met with officers and several IJB members following the last IJB to discuss how we would develop this going forward. Updated equality impact assessment. Again, Morgan's here today who can potentially answer any questions in relation to that. But there was also a further meeting with daycare providers and VAA, myself and one of my colleagues from Angus Council Procurement, to discuss some of the issues, and some of those issues providers raised with me face-to-face when I met with them earlier this month. And we had an opportunity to talk through particularly some of the data which Kathleen's raised today, also some of the expectations around needs versus the current funding that we provide. And really our hope and our ongoing commitment is to try and find ways and means to work collaboratively with providers. And since that last meeting, I've also followed up with an email to providers as well, looking for opportunities to gather further views and information. So I'm certainly committed going forward to doing that and having that open and transparent process as we go forward. Members will note within the report today in Appendix 1, we do have that timeline of engagement, which goes back a few years between daycare providers, the partnership in VAA, obviously taking account of what providers have said today too. The more recent engagement sessions I've been part of, which is the last two from this summer onwards, we have really seek to focus on trying to build collaboration and trust as well going forward, and really looking at the future steps to support providers to look at their business sustainability models, how we can capture outcomes and the impact of understanding the true cost of daycare, which takes into account safer staffing, which is something providers have highlighted today, as well as understanding our commission placement needs and other factors. I know Hayley from VAA is on the call today, and Hayley can perhaps provide an update on the engagement sessions that have taken place, as well as future planned sessions that VAA will facilitate. So, Haley, is it okay to bring you in at this point, if that's okay with you, Chair?
Yes, thank you.
Thank you.
Yeah. Hi, thanks, John. Can everyone hear me? Yeah. Yeah, perfect. I suppose just as the providers have already mentioned, there have been several meetings between Voluntary Action Angus as the third sector interface, supporting the third sector daycare providers. Most of that has been about, up until this stage, really, as has already been discussed, looking at the reports from the IJB, looking at how things are monitored, looking at how things are evaluated, really mainly looking at the previous IGP reports as per already discussed, and trying to figure out, well, where is everything and where does the providers fit into all of this. So up until this stage, I suppose that's as far as we've come, and we're now at the point whereby we have been engaging with John and Joanna, has already been discussed. And I suppose my next steps were clearly kind of set out within my appendix in John's report, and what I would be looking to now is exactly as was stated. I'd be looking at working with the daycare providers, but potentially moving away from that group setting and more on a one-to-one basis. The reason for that is mainly due to the fact that each individual daycare centre is an organisation within their own right, which means they run slightly differently and they have different needs and different support mechanisms in place, which would mean that one model wouldn't fit all, even for the fact of looking at a business model. The one-to-one support, I suppose, as I've already stated, is really to look at how we can then move away from where we are just now and really look at how we can create sustainable organisations, but that I suppose have less stress on relying on health and social care partnership funding or local authority funding, and they have more kind of income generated from other streams, and obviously through that provides some sort of backup and safety nets rather than having sort of all your eggs in one basket, so to speak. That's clearly not a very professional way of explaining funding streams, but it has been a bit of a long day here and I'm not in the office. However, the idea behind all this is to really look at how we can support and create more sustainable third sector organisations. That is the plan behind that. I think there is lots of potential with these daycare providers to be potentially providing more, potentially doing things more collaboratively with a wider third sector agency partnership, and also looking at things when we look at kind of key things that are coming on board, even examples of providing employability opportunities or placements or whatever that may be. There's so much scope here. And I think we lose some of that when we start talking about cuts and funding being taken away. And I think what we really need to look at is actually what can we focus on here? What's the good and what can we pick out of this? And how do we start building those important foundations? Really all I've got to add. Thanks.
Thank you, Haley. Chair, okay for me to continue? Thank you. To note as well, there's also with the Angus Carer Centre, and the view of carers have been part of the engagement plan for the development of the initial concept of a framework for daycare and day opportunities, which followed an initial meeting in December 2023. And throughout 24, the partnership did engage with Carers Influence Group, and the Angus Carer Centre also promoted the daycare survey, and staff from Angus Daycare were invited to attend forums in each of the daycare centres in Angus over 2024. So it's just for IJB's benefit to know that. So as Morgan's highlighted earlier, at present, due to no agreed framework being in place, monitoring between daycare providers and the partnership have not been taking place. Once an agreed framework is in place, which our hope is through the market facilitation statement, then monitoring can begin again, and that really will align daycare and day opportunities with every other commissioned service that we have within Angus for all of our care users across our various services that we commission. And at that point as well, it gives us the opportunity to consider how we take forward any efficiency savings. And I'll invite Sandy Berry in at this point, perhaps Sandy, just to provide some context on the finances. Thank you.
Yeah, thanks, John. And it is just really context. There is an indicative saving. Morgan's just mentioned that there is an indicative saving. It's set out in the paper associated with this work, but that's not something that we've agreed. It's not. It wouldn't. It's something that would come out at the end of a process. That is the nature of indicative savings. That saving was agreed by the board, or that indicative saving was agreed by the board as part of our overall financial planning. It was actually agreed in August 2024 in response to the challenges we saw in our financial plans as we considered them in April 2024. It was one of many things we agreed when we were looking at papers in August 2024. And other papers have already progressed. We've seen work on things like prescribing and other things already come to fruition. Other things are being worked on. It's maybe just worth me kind of referring back to the point I made from our external auditors this morning. They said it was imperative that the IJB continues to identify changes that will help financial sustainability, and it's important we follow through and deliver those. But I would stress again, this was an indicative figure in our financial planning. Any saving would only ever fall out at the end of a process. And certainly, it feels to me that this, approving a paper such as the one we have today, is about kind of moving the process on. It's not about saying there's a definitive monetary saving flowing out of the decision being made here. It allows a process to move on. So, John, that's the context. It was part of a bigger picture, a bigger financial plan that we were looking at. And this review, as I say, only had an indicative saving attached to it. And that could only be firmed up if the review concludes.
Thanks, Sandy. I'm just about finished here. Thank you. As well as from the last IJB, members did request that there was some data added to the report which is contained today. Now, I know Catherine and Irene have highlighted some of the issues from their end around the data that we do have as a partnership. And I think it highlights some of the challenges that we have at the moment without having a framework in place and without having monitoring in place. It's really difficult to actually gather the data that we need to have from your end as providers and also from our end as commissioners as well, so that we fully understand the needs, we understand the risks, we understand what the true cost of care is as well. So certainly a fuller data set would be produced once monitoring is back in place. You'll note as well, members, that the report recommends that current levels of funding remain in place until March 2026, and then from April that any adjustments around funding would be commensurate to planned activity, levels of need, taking into account other pressures that providers have highlighted today, which would include safer staffing, which has been highlighted, the building costs, and also the level of need linked to the service users that our providers are providing support for. So, members, you'll note that 4 recommendations within the report. I'm obviously happy to answer any questions and have other colleagues here who may be able to contribute to those answers as well. Thank you.
Thank you, John. Questions, George?
Thank you, Chair. I've heard a couple of times that the £100,000 is notional or words to that effect, but the actual recommendation 2, asks us to acknowledge that the 100k of efficiency savings for building-based daycare service was approved. Approved. I don't see any of the words, unless it's in the 5224 report, about indicative 100k. Where does that come from?
Yeah, thanks, George. I haven't got my computer open, but I'm absolutely sure from having read the report within the last day or so that the box that described £100,000 did say an indicative saving of £100,000 in it. Absolutely sure of that.
That's in the 5224?
Yeah, in 5224. Yeah. Now, somebody's going to check that probably while I'm still speaking. I'm 99. Oh, Dave, are you able to confirm that? No. Anyway, I'm 99.99% sure it did say indicative in there. The body of this report at section 7.1 in this report that we're considering today does say an indicative target of 100k was agreed at that point. So, George, we weren't definitive about that, and a lot of the plans that we put together, I think, includes plans that we saw at our August meeting of this year. We're setting out an expected figure that we are working towards. But that doesn't always work out. Sometimes a bit more be delivered, sometimes a bit less, and sometimes something doesn't work its way through. But when we're trying to present plans to this board, we're at times we're giving an outline of how we'll get from wherever we are to wherever we could be in 1 or 2 or 3 years, the nature of strategic financial planning. And that was a strategic financial planning paper that we saw at the time. So there will always, not with everything, but with many things, there'll be an element of estimation or indicativeness about the figure, and it has to flow through. I say this, for me, feels like the process where we go from an indicative figure to a more definitive figure, whatever that may be, something or whatever, we don't know. Is that okay?
Yeah, that's fine.
Okay.
I have another question, if that's okay. Yeah.
Jill would like to come in on that point first, George.
Yeah, thank you, Chair. Thank you, Sandy. Just to confirm that the reference in report 5224 is a potential contribution by 26-27.
Yeah, the other question, I'm not sure who to ask it of, but there have been several meetings with VAA and the providers. There's been at least a couple of meetings between the IJB and the providers, and yet the providers state they only knew about the 100k saving at a very recent date. How can that be?
I can only comment on the meetings that I've had with providers. So we've had 2 meetings since my involvement. So first meeting was, I can't remember the date, but July this year, where we spoke about the savings, which spoke around the £100,000, which was indicative of 10% of the overall budget for daycare. So certainly in my meetings with providers, that was raised at the first opportunity that I had to provide. Now, obviously, we're going back a year prior to that, whenever this was discussed. One of the challenges we've had is because we've not had any sort of framework in place, we've not had the opportunities to meet with providers, we've not had those opportunities to have monitoring meetings, and that's been part of the challenge here going forward. So, I'm absolutely committed to having that kind of transparent process that we've spoken about already today. So as far as going forward from here, there's ample opportunities, I think, as Hayley referenced within her point when she was speaking, to co-produce and to collaborate going forward, and that would certainly be the intention. But going back to a year ago, the opportunities have not been there to have those meetings. So, as I say, the last 2 meetings we've had, we've spoken a few times around this. I've been transparent in my conversations with providers and will continue to be going forward.
Thanks, George. Just on that point about the 100,000, I was just actually having a quick look at the financial paper we've got up later on. And, we've got a planned 1.6 million of savings as part of the financial planning. And we're only projected to achieve 1.5 million, 93%. So I think the 100,000 has always been, as we keep saying, indicative, and that's almost reflected in the finance report on a whole host of other savings targets, if I can call them that. So I think there is scope there to, it will be what it will be, as it were. If that makes sense. Got Kirsty first, and
thank you. I guess just to acknowledge there is real misalignment between the reports that are being presented from Partnership and VAA and then from the deputation. And given the comments about collaborative work and working jointly on this, I guess my question is where do we go from here, and are the conditions present to continue on a collaborative basis and conclude the work in the timescale that's been given? Because I see that we recommend the funding continues to March 2026, and the second part of my question is about whether that is a realistic timescale, whilst acknowledging how long we've been discussing this for and the ongoing kind of financial pressures, but also what the transition and risk management planning is to ensure that services continue to be supported, but also that adults continue to receive the right services in the time within and between what comes next. Thank you.
Thanks, Kirsty. So the plan written down within the report and in terms of the future in Appendix 1, which Hayley's kind of broken down through VAA input, is that there is opportunities for those meetings to take place between now and March 26, where We look at the process for making sure that we get the right data, so we understand what the levels of risk and need are within the services. So we try and understand what a true cost of care is, alongside then having a process, a framework of the market facilitation statement in place where we can actually manage that contract and then look at what the future plans are. Without having that in place, it makes it really difficult to take forward those conversations. I think it's difficult to answer the question in terms of your first point around the misalignment. I think, Kathleen, you'd said, you're absolutely committed as daycare providers to engage collaboratively going forward. I am also committed to that collaboratively going forward on behalf of the partnership. We've got VAA on board to help facilitate those discussions. So the ground is ready in that sense, but we just need to have a process that we can use to take us through that. And that is what the hope is through the market facilitation statement, in the same way that we would do that with any other providers of any other social care that we commission within Angus.
That makes sense, and it's quite reassuring, I guess. How well do you think that's been communicated to all stakeholders in terms of that would be the plan, that would be where these meetings would be going? I guess, as Kathleen had referenced, some work to understand the true cost of the provision. Has it been clear enough that that's where this work would go next, or is there anything else we need to do differently to ensure we're all on the same page?
Thanks, Kirsty. I think those planned future sessions are exactly where we would have those discussions. And that really has to take place in order for us to then fully understand, because we want to be able to commission something that we will A, know is linked to what our strategic outcomes are for individuals within Angus, but also B, that it's aligned to what the actual cost is. So Kathleen made reference to the fact that the original contract is so old that we have set up that we need to bring it into the 21st century. We need to align it with what the current costs are. So to do that, that is the plan through these sessions, VAA to help facilitate that, but also VAA to offer, and Hayley, feel free to jump in, I want to speak on your behalf, but VAA to offer that ability to look at how sustainability can be built in as well for providers going forward, if there was to be any efficiencies to be found as well. So Hayley, I don't know if you'd want to add anything to that in terms of those planned future meetings.
Yeah, I think probably just echoing everything that you've said, John, and I think I would hope that the daycare providers were aware that certainly that was the direction of travel from Voluntary Action Angus's point of view. Anyway, we've communicated that quite clearly that we are looking at creating sustainable business models. We will look at external funding opportunities, and we will facilitate and support the collaboration between the partnership if that is the space in which we're required, and that's our role as a TSI, and that's something that we'll commit to moving forward, regardless of which organisation it was, really. But absolutely, in regards to daycare providers, that's where we're at the moment, and that's where we commit to be going.
Thank you. Jill, do you want to come in?
Yeah, thank you, Chair. And just to reiterate the commitment from a health and social care partnership, and I think we've got that commitment around the room from VA and the daycare providers. Sandy's alluded to, this is the vehicle to make this happen. So that is the reason that we're looking at the market facilitation approach. And just in relation to the timeline, Kirsty, obviously we've got a review of our strategic commissioning plan coming up anyway, and as part of that process we have to review our market facilitation plan and statement going forward anyway. So that absolutely brings it in line with that timeline from a market facilitation perspective alongside our strategic commissioning plan, and it brings a level of equity around all providers and commission services approach.
Thank you. Yes, Alison.
So thank you, Chair. So much of the conversation has focused on the provision of day opportunities in terms of daycare, and I just wanted to highlight my experience as a GP for around 20 years in Monifeith, Angus Town, where we used to have a daycare centre, and that went, and we thought, well, how will we manage, how will these people manage? But actually we still have daycare provision in a neighbouring town which is purpose built for that purpose, and we do have in Monifeith a variety of well, I don't think necessarily formal day opportunities, you wouldn't describe it, it has evolved organically to have a real sense of community around some of the opportunities for our older population and our younger population to come together, and it's really for me around social connectedness, authentic relationships rather than necessarily always a formal daycare setting. It's more about the opportunity for people to live rather than be cared for in that sense. And I absolutely recognise the value of respite care for people and people with more in-depth. But for me, this isn't making decisions now. This is about having a structured approach and allowing the opportunities for other things other than these daycare centres to happen, and where daycare centres are the right thing, to have them, you know, equity around provision of that across Angus and respite care equitably across Angus. So I have to say it's not my area of expertise to know about daycare, it isn't, but I do spend a lot of time in cared for, you know, in care homes in particular, and I think we can do this fairly, and it's not something to be scared of.
Lewis?
Yep, thank you. I think I'm glad that we've managed to separate out and define daycare as opposed to day opportunities, because I think that's really important. And I think just picking up on the points that were made in the deputation around the level of complexity and need that the daycare centres are experiencing, and that they are providing a lot of care and at times complex care and personal care. So I think that's really important. But I guess my question then is, we are also talking within this report though about day opportunities. And I just wondered what discussions and engagement has been had with the day opportunities providers within Angus. And I appreciate it is very different and what they deliver is very different, and perhaps a bit more on delivering kind of with what Alison was talking about there, but equally they are equal partners too. So I just wondered where they are in terms of this report and moving forward. How much aware are they of where we're at and what's being proposed?
Thanks, Lois. I think that's been some of the challenges, because we've, and I think rightly so, as you highlighted, and that's been taken into account what's been said from our colleagues within the daycare centres, is recognising that there is a difference between the two. I think we've become more focused through these particular reports around daycare, because the original driver was looking at the four providers through the market facilitation statement that Morgan's kind of helpfully highlighted the process. If approved going forward, it would align all our commission services together. So we currently undertake a lot of consultation with service providers, and some of those have included day opportunities within LD, other areas. So there has been levels of consultation. I think what we would be saying is, going forward, and actually the next paper highlights this a little bit in terms of what our plans are in terms of our commissioning implementation plan, is how we engage going forward, and some of the plans around that. We've spoken about previously having events and opportunities for providers to come together. The next paper highlights that we would be intending to do that if the market facilitation statement can be approved going forward. We've committed, and I know there's been issues highlighted around engagement over the past couple of years, but what you do see through the engagement process is, and certainly from here onwards as well, is that we are committed to trying to understand what needs are. We know that we've got changing demographics within Angus. We know we have changing needs. We know that we touched on unmet need earlier on for individuals who are receiving care at home. We know that the needs are higher for folk who remain at home. We know that those who attend daycare centres, the feedback from our colleagues within daycare is that they're seeing more personal care being sought. So we are going to have to constantly engage with providers going forward. So I think there's been elements of that throughout. I think going forward, if the market facilitation statement is approved and agreed, we would use that as our mechanism to ensure that we've got a good engagement strategy that's equitable across all our providers going forward. I hope that kind of answers the question.
So, touched on earlier about the kind of rise in levels of poverty and inequality and financial hardship. I think it has been mentioned today around, the ask would be, or the expectation would be, that the providers, the daycare providers, would look to a different model of funding and look to bring in more paid for places. What impact will that then have on those service users that cannot afford to self-fund and who may not be receiving support from the partnership because they're perhaps, or maybe they receive some support, but not enough to allow them to go out and be supported through daycare? What risks are there?
Thanks, Lois. So I think this links to unmet need conversations as well, doesn't it? And we know that within the challenging position that we're in fiscally, and this is a national issue, that we are focusing on our critical and substantial needs, but also what we commit to as a partnership is to signpost individuals where possible. And we've got good examples of that. We've got some excellent examples of that even within our adult support protection framework, where individuals who don't quite fit the criteria for full adult support and protection support, they are still signposted on to other organisations. So we will continue to do that going forward. I think Alison's point around the having a broader spectrum of services across the board is really, really important, and something that the market facilitation statement gives us is an opportunity to look at how we consider future tendering options, because I know you've raised in previous IJBs around the needs and issues within Arbroath and the fact that there's potentially gaps there. Well, actually, there'll be the opportunity through market facilitation to think, how do we consider or develop services in other areas? What's going to be best for individuals where they don't have access to certain transport links? It's a difficult one to answer fully, but I think what we've shown so far has been, despite the challenging position that we're in, despite the fact that we are focusing around our critical and substantial needs, there's still individuals being signposted on to support that's commensurate to the level of needs, and that's why the third sector is so vital, and that's why our commissioning strategy is really vital going forward. Phil.
Yeah, thank you. And I'm just going to reflect back to the August IJB, where we did hear around the positive kind of move from the outreach to from the physical disabilities service. So there will be learning from that we'll pick up on some of that, Lois, that you've mentioned, but just to reflect on the positive outcome of a shift of a model for individual needs as well. And we will take that learning forward into this piece of work too.
Yep, do you want to come back again, Lois?
Sorry, yeah, I definitely do feel concerned that unless someone has got the financial means, they're not perhaps going to be able to have the same opportunity to access and choose the type of support they want unless they can pay for it. And that for me is a real concern. And just for clarity, in terms of this kind of framework and the procurement going forward, I guess the daycare providers and day opportunities providers and everybody else that's providing a service or would like to provide the service for a whole range of needs. It could be autism, it could be a whole host of different services and supports that they want to provide. They're all going to be, I guess, competing against each other, and there's only so much monies that obviously the partnership has, and you are trying to make savings. So I guess my concern is that providers are going to face that difficult predicament of not being able to operate a service. If you're going out to tender for daycare in a particular location, then it would just be daycare providers that would be coming forward, or there might be times where you're looking to meet a particular need. How would that work? What is that likely to look like? And is there a risk that you might tender for a service but choose more of a day opportunity rather than a daycare? How does that all work?
some challenges to answer that question, Philly, because there's an element of crystal balling with that, I suppose. But I think going back to your initial point, it's really important to understand and recognise that every single support service that's put in place is undertaken off the back of a comprehensive assessment, and that will include someone's financial means. We look at benefit maximisation as part of that as well. So how can an individual's benefits potentially be maximised to consider other areas of support as well? It is really challenging, there's no doubt about it. And in certain areas we know where we have areas geographically within Angus where it's harder to find service provision than in other areas. So difficult to fully answer that question. I think what we'd be looking to do is how we as an organisation want to be more data driven and understand what the needs are within our localities, how we continue to make sure that our assessments are comprehensive and good and that we maximise financial benefits for individuals, but also recognising, as you've rightly said, for those who can't afford, how do we continue to provide that support in really challenging times? Well, my argument would be that we do that through good market facilitation, where we try and understand the needs of a community and then respond to that and look at a tendering exercise to try and best meet what those needs are. There's clearly always going to be need for some individuals to have a higher level of personal care, and that's more commensurate to something that's going to be a building-based daycare. If we're using daycare or day opportunities, not everyone will need that. Some might benefit really, really well, as has been heard through other bits of work from more community-based resources. So some of it will be around linking needs to localities, some of it will be around what is the appetite out there for other organisations, recognising some of the geographical challenges that we do have in Angus as well. So a difficult one to fully answer, Lewis, to be fair. But
yes, Martin.
Thanks, Chair. And I've listened to the discussion. How do we move forward?
Yes.
How are we going to move forward? What is the plan? A lot of talk now is about process and future and everything. How are we going to move this forward now?
Yep, Joe.
So I guess, Martin, in terms of moving forward, what we are proposing is that we use the process that we have in place for other commissioned providers using the market facilitation approach. The other element of that is the personnel involved. In the partnership we are committed, V&A are committed, and the daycare providers are committed. So if we can get approval in terms of the recommendations today, then that will allow us to move forward. If we don't get approval in relation to the recommendations that are detailed within the report, then we do have a risk of not being able to progress further. And that will impact not just on daycare services, but other partnership services as well. And that will ultimately impact on the IJB's ability to deliver on their strategic commissioning plan.
Yep, Martin again.
Then can I ask for a recess for the voting members to maybe move this forward?
Yeah, still a question.
David, sorry.
Thank you, Chair. I would start by saying, given the conversation that we had at the last IJB, this in some ways wasn't the report I was expecting, since a lot of the conversation was about the impact of the proposal that was on the table at the last, and unhappiness about the amount of detail in that. And in fact, but that isn't what we've come back with. We've come back with something that's very different. So the question which I raised at the last IJB still stands, which is we still don't know the impact of any of these proposals. And what is contained in here is that that will have to be assessed as this process on an iterative basis. So we are no nearer getting an answer to that question that was raised at the last thing. I'm seriously concerned that there isn't actually any reference in this report at all to carers. And that, given the references that have been made to the importance of respite, and the fact that provision of respite for carers is one of the sort of, as I believe it, the two main objectives of the provision of daycare, and it was referenced several times by the presentation that we received. So my concerns at this stage would be that we've now had a process outlined, which I don't have any difficulty with that process. I do have a big major difficulty with the very short time frame that's now available to that. Given that we've had the initial presentation about the opportunities presented the best part of 2 years ago, and we're now about to use the next 4 or 5 months to try and do all that work. And I think the issues about establishing impact, data, process, notwithstanding the need of our providers beside us having to sort of work on the whole business management, business modelling around that, I think that is unrealistic. And I would ask that consideration be given to the commitment which currently runs to the end of this financial year in terms of finding that, notwithstanding the fact that a commissioning framework needs to be approved, that there is a commitment to extend that, because I think it is unrealistic to get that work done comprehensively. But that's for others to come back on that. So my main concerns are about now the time frame to rush that work, and the impact, and the fact that we don't have any impact assessment at this stage, and particularly regarding, well, my concern is obviously regarding carers.
Okay. Jill?
Yeah, thank you, and thank you, David. I think you've highlighted the importance of getting the recommendations through today to allow us to be able to progress with the work and be able to assess and describe the impacts of the proposals. I think in terms of the unrealistic timescale, we believe that March is realistic timescale for us to be able to do the work. As I've said, we have to bring back the updated market facilitation statement anyway as part of our strategic commissioning plan. We absolutely remain committed, and from a timescale perspective, we feel that from a partnership perspective we will be able to deliver within those timescales, given that the delays that we faced so far in terms of getting to this point.
Yes, Alison.
Yeah, so moving things away slightly, I don't want to take away from the importance of daycare services for the people that need them, but just in terms of what we're doing around some of the inequality in our communities and the need to address transport concerns, the work that's being done by the socially connected subgroup of the Community Planning Partnership is very much looking at that area of care that isn't dependent on providers necessarily, but certainly working with providers. So things that are part of that are developing neighbourhood connector approaches, micro neighbourhoods, looking specifically at particular communities, extending neighbourhood level connection, embed training of the workforce in loneliness, strengthen transport and digital inclusion across rural and urban areas, grow youth working age, intergenerational. So there's a whole programme of work that is looking, and certainly the sort of longer term, embed social connection into strategies and commissioning. And that, just to say that that bit of work that is for people that don't need that very cared for environment, that bit of work is progressing, and I'd be delighted to catch up with anybody offline who's interested in it, because I'm really quite excited about it. Thank you.
Thank you. Have we got any further questions? Nope. Okay, I think we'll do as Martin suggested, then we'll have a quick 10-minute recess and then come back, if that's okay. Thank you, everyone.
Okay, sorry, you the live stream for IJB, please?
Okay, thank you again, everyone, for your patience. Before we kind of move to recommendations, is there any final questions? Lois.
Yeah, I just would like clarity, Chair, with regards to, we obviously have the recommendations and like some amendments to them, but also just if you could kind of describe in terms of where we're at, but what's being proposed in terms of working out the model and the cost of care. Sorry, I'm trying. It was a long adjournment, and we talked about so much. In terms of identifying that true cost of care, and once that bit of work has been done, what will the process and mechanism be in terms of reporting back to IJB? So, will you be coming back with a set of proposals for IJB, or would you be going away off and then progressing with that bit of work, or are you going to report back? We need some assurance around that, please.
Okay, so I guess it depends on the outcome of that. Obviously, from a health and social care partnership perspective, we have a responsibility on behalf of Angus Council to deliver the services from an operational delivery perspective. If that changes the strategic nature or the strategic direction, then that is what would come back to the IJB. If it has a significant impact on the strategic financial plan, then it would come back to the IJB. But in terms of the operational delivery, that would sit through the Health and Social Care Partnership in terms of the implementation. Hopefully that answers your question.
Sorry, thank you.
Okay, if we have no further questions, so as everyone will appreciate, we've had a bit of a recess, a bit of a chat through the recommendations. So what we would like to propose is that the recommendation 1 approve the planned approach to utilising the market facilitation statement interim update 25-26 as the commissioning, tendering and monitoring framework for daycare and day opportunities in Angus remains. We are removing recommendation 2, which is to acknowledge the 100,000 of efficiencies, and obviously a full costing exercise will be undertaken, and then obviously that leads to efficiencies or whatever costs, then that would come back. In relation to the third recommendation, which obviously would now become recommendation 2, approve that current funding levels for daycare will be maintained through to March 2026, and an update on the position be reported back through the Chief Officer's report to show it is on schedule. And recommendation 4, which now becomes recommendation 3, acknowledge the indicative timeline, so a change there to indicative, because obviously we're conscious that it is quite a tight timeline. Indicative timeline and approach of engagement between AHSCP, daycare and voluntary action Angus as presented in Appendix 1. Have I got that right? Yep. Everyone content with that? Yep, approve those recommendations. Thank you.
Thank you, Chair. Okay, so...
Apologies, John, I'm way ahead of myself. So if I'm proposing that, have I got a seconder?
Just so that
George, thank you.
Okay, and there was no...
Okay, apologies, John.
Thanks, Chair. No, you're fine. Okay, so the report for IJB today is to provide an update and assurance on the Commissioning Implementation Plan 25-26. Members will be aware that the Strategic Commissioning Plan continues to drive the work of commissioning of social care in Angus, and the current commissioning plan is being refreshed and will be coming to IJB in early 2026, February 26. As was discussed in the daycare report just previously, members are aware of the interim market facilitation statement was developed and approved by IJB in May this year in Report 3025. And as per recommendation 2 of today's report, it's proposed that a refreshed market facilitation statement is drafted alongside the refreshed strategic commissioning plan for 2026. So the commissioning implementation plan was developed this year to support the rollout of the current interim market facilitation plan. Members will note the 9 updates on our current position on delivering this. So based on the level of progress across the actions, it's proposed that IJB accept a reasonable level of assurance on the actions being taken forward. Some of those are for next year, as are noted. Members will also note potential impacts associated within our agreed efficiency savings targets, alongside the stated risks linked to commission service provider failure, but also the mitigating actions that we have in place in regards to that. So you'll note the three recommendations for consideration today, and I'm obviously happy to answer any questions in relation to this report. Thank you.
Thanks, John. Do we have any questions for John? Nope. Just one from myself. The Care Home Development Fund for providers to bid into. Just wonder if you give me a bit more detail how much it is and how it's phased or whatever.
Yeah, thanks, Chair. So I did meet with care home providers, and that was part of a discussion. I think Gemma Reid's still on the call. Yep, Gemma Reid from Scottish Care was facilitated that meeting, and we did discuss some possible options around the overall sustainability of our care homes across Angus. Members will be aware that most of our care homes are commissioned, and we recognise some of the challenges associated financially for care home sustainability going forward. So we did have an initial discussion around possible options that we can look at to help sustain and provide support. We do have a further meeting in November this year that again Gemma helpfully is pulled together. So I'll be meeting with providers again to take forward those further discussions. So probably can't add too much more at this point, Chair, but we are keen to keep engaging with the sector and listen to them, understand what some of their issues are, and consider any means or options that we have to try and support sustainability.
Thank you. Any other questions? Probably just a slight amendment from myself. The recommendation 3, accept the level of assurance. It's obviously a reasonable assurance, so that we've got from the report. So we're happy to approve the recommendations. Yep. Excellent. Thank you. That moves us on to item 10, Angus Primary Care, which is that you, Joe? Sorry.
Yeah, thank you, Chair. I'm going to present on behalf of the primary care team, and I've got Angela and Alison and Dr Scott Jameson on the call as well if there's any questions. So this report provides the board with an update on the progress being made across primary care in Angus, with a focus around the implementation of the primary care improvement plan for 25-26 and the ongoing work with the Angus GP practices. So primary care, as we know, remains a cornerstone of our local health and care system. It's part of the system that most people experience first, and it does play a vital role in prevention, early intervention and supporting the care. As members will see in the paper, the last 6 months have seen solid progress across all of our PSIP work streams, despite the continuing pressure on workforce, finance and our estate capacity. Our primary care fund continues to support more than 70 whole-time equivalent staff across Angus, including advanced nurse practitioners, pharmacists, pharmacy technicians and CTAC nurses, link workers and peer support workers. These multidisciplinary teams are now fully embedded within practices and are making a real difference to access, continuity of care and patient experience. Within specific services, just drawn members' attention to the urgent care ANP team, which I did highlight in a previous Chief Officer report in terms of their national award through the RCN. Pharmacotherapy does remain a challenge in terms of recruitment, but our use of pharmacy technicians is ensuring safe and effective medicines management. Our CTAC services continue to expand and evolve to include anticoagulation minor injury as per previous, and that work is continuing to expand across Angus. We're also testing out the new models of care around occupational therapy and general practices, and that will allow us to further embed our community link and peer support workers along with our OT colleague within that test of change. And Heather's also here if members do have any questions on that. The report also highlights the annual GP sustainability survey, which shows what we would class as a cautious optimism compared to where we were last year, a slight improvement in terms of recruitment and non-clinical staffing, but with increasing concerns in relation to premises, which reinforces the importance of our GP premises strategy. Finally, or financially, the PSIF position is broadly stable, though we are forecasting a small in-year overspend, although what is detailed in the paper has now reduced following further work. Overall, the paper demonstrates that while significant challenges remain, particularly around premises and workforce, Angus continues to deliver high-quality, sustainable and innovative primary care within a complex and national context. It also highlights the strength of collaboration between practices, clusters and the Health and Social Care Partnership team. The recommendations ask for members to note the progress, the financial position, the ongoing position around GP sustainability, and there is an associated direction to approve for NHS Tayside. I'm happy to take any questions, Chair.
Thanks, Jill. Yes, Sam.
Yeah, Jill, thanks for a very detailed report. I was pleased to read that the Scottish Government at 5.953 recognised that under the current processes, primary care premises are not being prioritised, and there is a glimmer of hope that there may be some funding. How bright is that light, I wonder?
Thank you, Sam. Again, without a crystal ball, I'm not sure how bright that light is actually shining at the moment. But we do know that there is a bit of work going on through Scottish Government around the primary care infrastructure, and hopefully once that group develops more and we get a bit more information alongside the work that's going on around business continuity planning for NHS Tayside, that will allow us to see how bright the light is shining.
Martin.
Thank you, page 147, 5.66. This GP sustainability group, will they just be reporting to themselves or will they be reporting back to the IJB? I'm unsure where they're going to work together, identify improvements, etc. So where is that going to be reported?
Okay, so within NHS Tayside we do have a primary care board that all of the sustainability does come through on a Tayside wide level, Martin, and we will feed that in through the executive team from an NHS perspective. Again, if there's any strategic direction that is required from an IJB perspective, then we would absolutely be looking to bring the report back to the IJB, but Dr Clement might want to come in.
So the GP Sustainability Group is formed of myself, Dr Jameson, Angela as Primary Care Manager and GP reps, and it really is a collaborative group so that we can have honest conversations around what the issues are, and it's really a sort of problem identification and working through together group to make sure that we don't that we address problems in a practical and pragmatic way on a timely basis. It's not so much of a executive reporting group. However, I'm there, Angela's there, and we do escalate through our normal routes, myself to the executive management team, and primary care is regularly discussed there.
Thanks, Alison. Any other questions? Are we happy to approve the recommendations per the report? Yep, brilliant, thank you. That takes us on to now item 11, which is the finance report.
Okay, thanks, Chair. Good afternoon, everybody. This is a regular finance report. You'll be familiar with seeing them. I'm just going to highlight a few points, keep things relatively brief, but happy to answer questions at the end. The background section of the paper at section 4 notes that the IJB is still forecasting an underspend this year. There are one or two reasons for that. They're again outlined in the paper. Some of those reasons are probably one-off type factors, and I've highlighted, I'll mention again in a second, things like prescribing are probably, there's probably some one-off factors in there. There's also some underlying improvements in some of our service positions, and I'm hopeful some of that will be an ongoing position that will then help improve the overall financial plan and the future financial position for the IJB. But there's a mix of one-off and kind of ongoing factors in our current reported position. The main section of the report, section 5, gives details about a whole range of services. I'm not going to go into detail, but just highlight one or two things in there. There's a section about out of hours, and that's going to be on that's on the work plan for coming back to the IJB in December. I mentioned about the prescribing position. It's worth just kind of keeping an eye on that in terms of the future trajectory for prescribing spend. And there's updates on where we are with regards to mental health and our disability services, things that we've seen before, and we've tried to capture some detail in there as well. Chair, there's a couple of areas further on into the report that I'd like to highlight. One is regarding section 5.4, where we look at where we are with our savings plans or our planned interventions. Table 3 highlights our reliance on the delivery of savings going forward. And there's a whole set of tables there reflecting on papers that we've seen in August 24 and August 25. So there's a lot of things that are still scheduled to be delivered in that paper. And I mentioned right at the beginning of the meeting, we are probably going to try and change the format of how we share this information with the IJB board to give a clearer understanding of the assurance regarding the timeliness of delivery and the scale of delivery of savings. So hopefully that will come through in the next couple of finance reports in either December or February. In section 5.421, we just, again, this ties back with the outstanding action points from right at the beginning of the meeting. We're just flagging up where we are with addressing residual shortfalls. I'm hoping that we'll have an update coming back to the December meeting. And we did try to summarise where we are in section 5.4.23. I don't know how we've managed to make our numbering quite so complicated. We'll have a think about that. I'm sure it's something to do with the report template. I'm sure that's what it is. But there's a line in there, and I just want to read it out because it is important. It does say, taken together, things like the delays and challenges, identifying savings and identifying things that might close the financial gap, alongside challenges and delays in delivering previously agreed plans. These are the things that will complicate matters for us, and they might end up with us being behind the curve of where we need to be in terms of sustaining financial sustainability. And that ties right back to things that our auditors were talking about this morning at the IJB's audit committee, but things that we all know well and have seen through our financial plan. So it's really important to keep that in mind. And Chair, the final section I want to highlight is section 7.4. 7.4 ties in one of the recommendations of the paper, and it talks about funds that we have in our system that are not yet allocated, being some reserves from last year and some of our in-year underspends, the ones I mentioned earlier on. And it's a recommendation that we sit down with a suggested group of people to look at how that funding could be deployed and come back with proposals to a future meeting of the IJB, possibly December, if not December, February, to give ourselves a position on how we work to deploy that funding. And with that, Chair, I'm happy to take any questions on the paper.
Thanks, Andy. Do we have any questions? Yes, George.
Thank you, Chair. Just for clarification, it's probably my reading of the sentence, which is fairly common. 5.4.2.3a. The bit that you actually mentioned, I think, taking together the delays and challenges linked to identifying options to close the financial gap and the delays in delivery of previously agreed plans, suggests that IJB is now sitting behind a planning delivery trajectory that would be sufficient to contain the projected financial challenges. Is that good news then?
Okay, so just to clarify the numbering, the A is A. It's the first letter. It's, just so we know, just to avoid any further confusion. So no, that's not a good thing. I'm afraid I thought it was. I was trying to capture a few things in that sentence, and it is quite a long sentence, maybe a bit complicated. We set ourselves a target in in 2024 of trying to identify and take forward about £3 million of savings, because we felt at that time we needed to be moving forward about £3 million of ideas a year to close things out. And when we looked at our financial plan initially in February of this year, we again said we need about that number to keep on top of things, not to be delivered this year in here and now, but to come into our plans over a 2 or 3 year period, about £3 million per annum. And we haven't managed to do that in this planning period. So between February, when we said we needed to identify that, and now we've only identified about £1.1 million. I'm hopeful more ideas will come back to the December IJB. So we're behind where we would choose to be, or where we would want to be. So that's not a good thing.
Any other? Yes, Chris.
Sandy, I noted your comments around fiscal sustainability and reliance on savings, etc. But something that came out just a little while ago from the Scottish Government was their fiscal sustainability delivery plan. The good news is it's got an acronym, so you don't need to say that every time. But that's predicted a 2.6 billion shortfall in local government funding by 2029, 2030. So you talk about tipping points and whether a tipping point might come early. There is a rocky road ahead. And I know at the last IJB I shared my own worries about my nervousness about the impact of the cuts on services, on service users and the workers who deliver those services. It was really for a point of information rather than a response. But that fills me with a great deal of worry and of fear. And that current Scottish Government policy seems to be relying solely, and I'll quote, on cost cutting in the public sector and economic growth. Well, good luck with the second one. But it's relying on that rather than more radical approaches. And I think as voices, as trade unions, as IJBs, as employers, we need to be loud and clear to the Scottish Government that this continued reliability on cost cutting, cut all the time, without addressing the root causes of the issues around funding, particularly in the forum that we're all interested in, which is health and social care, is extremely worrying. And that our own Scottish Government is predicting that shortfall and go, well, here we are then, we're just going to have to keep relying on cuts. We can't do it, it's unsustainable. The demand for social care is increasing and other council and NHS services. But quite honestly, I'm even more nervous than I was at the last IJB now about how this is going to look in the next 2 or 3 years for our service users, our communities at Angus. I think we need to be hugely mindful of that. Thank you.
Thanks, Chris. And you're probably just saying what everybody in the room is thinking. So it's it's not a it's a challenging outlook, definitely. And I know that all the IJBs have collectively, I think through COSLA, have approached the Scottish Government to outline their position, and by and large what you're sort of saying is that cuts are no longer sustainable with the growing pressure on services. So you make a really valid point. Alison.
So I agree with what you're saying. However, I want us to also be brave around what we can do and not give up and think about being protective of our individual services. Where is it we can work together? So I wouldn't want that fear to stop us collaborating, speaking and being brave about new ideas of where we can work together, because we have some examples in Angus now, and I would highlight maybe the long-term condition work with Angus Alive around how we've signposted people to leisure centres and their memberships are coming up all the time to beyond pre-COVID level. That's an example of where we can increase sustainability of services, albeit maybe not ours, but certainly good services by working together. So I do think that I know that it looks like outlooks bleak, but I do think that we need to be still brave around that prevention, proactive care, and where we could use our strategic reserves to invest now to make efficiencies in the long term. And I wouldn't want us to give up on that.
Good point. Martin.
Thanks, Chair. Thanks, Andy. On 7.1, we're talking about an underspend of 2.596 million. And usually when we talk underspend, it's unfilled vacancies are considerable in that. But I notice it's only £500,000. So where's the other 2 million underspend?
Yeah, thanks, Martin. I mean, section 7.2 of the report does flag up a number of other areas that have contributed to our position this year. The one that is the biggest difference from our financial plan is the forecasts that we had for prescribing compared with what we've actually seen coming through this year. That is markedly different. We're not unique in that, but markedly different from what we thought we'd see this year. And so that is the biggest single factor. There are other factors set out in that paragraph. But I think, because I'm speaking about prescribing here, I think I really need to draw attention to the body of the report, where we do say that there are a variety of external market conditions regarding prescribing that may mean some of these factors are non-recurring or one-off or time-limited, and that prices and the costs of prescribing may eventually move back to where we thought they would be. So, Martin, there are a few bullet points in section 7.2. Prescribing is the biggest thing that's diverged from our plan, and it has been in our favour this year. But the suggestion from national, the national networks is that there's been some temporary phenomena, not just in Scotland, but globally, that have brought the prices down, but we might see the drug market correct itself, and prices might change, and that might see some of our costs move back up. Hopefully that's okay. Chair, can I just come back to the two comments from earlier on? I totally understand the points that Chris has made, and certainly in all the discussions I'm having, the position does obviously look increasingly challenging on all those points that you've made. And I think we as an IJB, we've got in this paper here, there's a list of financial risks in Appendix 2. And these are individual local risks, but they are all indicative of that much bigger position that has been described. There's workforce risk, funding risk, cost risk in this table. But I say they're all part of this much bigger challenge that we will all face. But I do agree with Alison. We need to do what we can, because the one thing we want to do for as long as we can is maintain control over our own destiny and the delivery of our plan, and being able to keep on top of where we are, on what's in line with that curve, making sure we're keeping an eye on financial sustainability. That will mean for as long as possible we're in control of our own destiny in terms of delivering the plan.
Thanks, Andy. Happy to approve the recommendations per the report. Excellent, thank you. So that moves us on to item 12, strategic planning update. Yourself, Eunice, yeah.
Thank you, Chair. I'm going to ask Samantha Anand, who is the Service Leader for Adult Mental Health, to come forward to share a service user story before I present the report. Thank you.
Thank you. Hello. Today I would like to share Simon's story. His name has been changed in order to protect his identity. This story may be triggering for some, as it does discuss suicide, and I want to highlight this in advance of sharing his story. Please keep yourself safe while listening to and after hearing Simon's story. Simon's story highlights the support he received from the Beacon, which is our new community wellbeing centre, a safe, homely and welcoming environment for those experiencing emotional distress. Simon is currently open to both the Community Mental Health Team and Angus Integrated Drug and Alcohol Recovery Service for ongoing support in respect of his mental health and substance and alcohol dependence. Simon was referred to the Beacon as a result of experiencing suicidal ideation. Simon has experienced childhood trauma, which continues to impact his mental health. He was contacted by telephone by the Beacon after the Community Mental Health Team referred him for support. He spoke with a peer worker and explained his ongoing mental health issues. Simon was distressed during this call and stated that he was planning on ending his life. Simon disclosed he had suffered several traumas in his life. His childhood was abusive, he had fractured family relationships, and he described feelings of guilt, shame, worthlessness, and hopelessness. Simon felt it would be better to end his life than to carry on. He was planning to die by hanging. During his call with the peer worker, Simon was given a safe space to talk. He was actively listened to with empathy and compassion. He said he felt heard and disclosed that he had not been sleeping well for over 2 years. The peer worker further explored with Simon how he was feeling, and it became apparent that Simon was lonely and he was struggling with his lack of sleep. He stated that he didn't actually want to die, but he also didn't want to wake up. The peer worker offered to undertake a suicide safety plan with Simon. They further discussed coping strategies and signposting for a befriending service. The peer worker contacted Simon the following day, and during this call it became apparent that Simon was distressed and that he was under the influence. He stated that he still wanted to die by hanging, and police were called to undertake a welfare check. Police attended and supported Simon to attend the beacon in person. Simon spoke more with the peer worker about his childhood experiences, and during this conversation stated that he felt heard and cared for. The peer worker discussed further coping strategies with Simon, and they spent time covering these in more detail. The peer worker shared some of their lived experience, and Simon noted this made him feel understood and made him feel more hopeful that things would actually improve. Further safety planning was then undertaken between Simon, the peer worker, and Police Scotland prior to Simon returning home. Simon contacted the beacon the following day to thank them for their support and noted how important it had been for him to have space for someone to listen. I hope you agree that this story showcases the collaborative efforts between partner agencies, in this example between the third sector, Angus Health and Social Care Partnership teams and Police Scotland, in order to ensure that people are receiving support in respect to their mental health at the right time, in the right place, and by the right people. Thank you.
Thank you. It's quite sobering when you hear stories like that, but when you hear those organisations coming together and the work that they've done, I think it's a wonderful ending to the story, which does strike a chord with me. But anyway, sorry, Eunice.
Thank you, Chair. And I think, yes, you're right, that story really highlighted some of the challenges that we have to work with on a daily basis, and the staff that we work with right across those that are working in the priority 3 area, which is around mental health, learning disabilities and substance misuse. And I'm really pleased to bring this report today, which is an update on our strategic commissioning plan aligned with our national and local strategies. You will note in section 5.1 table that there's boxes missing under the learning disability plan, so please accept my apologies for that. That should read there are 15 actions, 6 are completed, 5 are on track, 2 are amber and 2 are merged with other actions. You will see in the report it's a very busy area of work, but we've got a lot of highlights because there's a lot been going on since we brought our last update. So the Living Life Well plan has progressed. We've already heard that the Beacon Community Wellbeing Centre has been opened and it's fully operational since June 2025, and you've heard the impact that it's already had on one individual's life. We have our enhanced community support hubs supporting over 14,000 referrals to date. We have had a staff award for a bronze award at the NHS Tayside Star Awards, and we're currently developing our neurodevelopmental pathway. We have mental health peer support, and again you'll see in the report the number of referrals that have been actioned within a 14-day period. A lot of work is done around suicide prevention. We have an action plan, we've done training, we've got bereaved by suicide support groups, and hopefully you've all been aware of our Are You OK campaign that is regularly out on our media channels. Within learning disabilities, there's a lot of work there around our inpatient transition programme and the work that we're doing to develop community models around Tayside intensive support services. We've got an expansion on our resource centres. We're doing a review on respite arrangements for adults with learning disabilities and our coming home implementation work. In terms of substance use recovery, we have had the ADP report a couple of months ago, and we heard a lived experience story at that point. We're also seeing a rise in cocaine, ketamine and alcohol referrals that we are addressing. And we're also seeing a rise in older adults with alcohol dependence, increasing frailty care packages that are required, and that's all under review to make sure that we're able to deliver for that cohort of people. Around psychiatry of old age, we're really pleased with the Carers Academy that we've highlighted before, and the number of carers that have been trained in this approach and receiving really positive feedback around that. We've also done quite a lot of work around our discharge planning, increasing flow, and you'll note in the report a reduction in out-of-area placements for psychiatry of old age patients, which is really positive. Within the report, I've also highlighted the Mental Health and Learning Disability Whole System Change Programme update. This is not a separate update this time, and you'll note that there is a focus on engagement around the model of care. There was an IJB session on that just on Friday, and there's further engagement across Angus between now and December. You'll also see within that there's an increase in frequency of meetings around that work. Today, I'm looking for substantial assurance around the work that's been done across all these areas around priority 3. And I'm happy to take any questions. I've also seen I've got all my colleagues here that are service leaders around this area of work, so they'll also be happy to take questions. Thank you.
Thanks, Eunice. Do we have any questions? Martin, then Louise.
Not actually a question, just a comment. And as alcohol and drug champion for the NHS Tayside, you have to be congratulated on the work that's been done in Angus. It's really, it's heartening. It's heartening because it's a hard slog, believe me. But thank you.
Louise.
Thanks. Yeah, I just had a couple of questions on 5.6. So I was just kind of wondering, how will the integration between community mental health teams, peer support services and third sector providers be coordinated in practice? And what measures in place to ensure consistency and quality across the different providers?
So there's a number of approaches. So some of our third sector providers are commission services. So that's done through contracts, reviews of information, service user engagement. We have, I'm going to ask Sam to come in, but we have various mental health groups. We've got AMHO, we've got different groups. So we talk about the approaches and the work that is done across the different providers and partners. So Sam, do you want to maybe come in with a bit more information around Louise's question? Thank you.
Thank you. I think just to follow what you said there, Eunice, I feel we do have several mechanisms when we work with our partner agencies. AMHO's a very good example where we've got membership from people such as Angus Voice, and we're working together with agencies such as Sharing Care Together as well to make sure that voice is heard.
Jill.
I was just wanting to add from a protecting people perspective that AMHON also reports through the Chief Officers Group as well, so they are cited on the partnership working that happens in that area of work as well.
Oh, sorry, Alison.
We didn't get a lot of time to go into the primary care report today, but it did mention around primary care OT. We've also got social prescribers or community links workers working in GP practices. And what we're noticing as the Beacon has come on board is actually it's releasing capacity within general practice, some of the peer supports, which is excellent. And it's not that there isn't lots and lots of other work for them to be doing, but as we are bringing the Beacon and new people on board, there's a bit of work to be done in just understanding the role of the links worker and the role of the primary care OT. And Heather Edwards there is going to do a bit of work and actually how do we optimise, and because we've got that capacity released, how do we continue on our journey of prevention and proactive care and sustainability of primary care and all our big risks. So it's all connected, and I suppose it gets back to my previous point around we do need to keep working together because that's where we get the biggest gains and the potential for savings.
Thank you. Any other questions? Are we happy to approve the recommendation? Oh, Lois, yep.
Thank you. Yeah, it was a powerful lived experience story, so thank you for that. And just to touch on the Beacon, it is good to see that work going on in the town. I think it's long overdue. I know that Reach Across have been doing similar works for the last few years and providing that type of support, and so it's good to see that things are moving forward positively because it has been an unmet need within mental health. My question was around, obviously heard that lived experience, and Eunice, you'll know that last week we attended a meeting in Carnoustie and heard from a lot of parent carers and young people and older adults with a learning disability or disability, some have physical disabilities, and they have a number of concerns around support, around accommodation, Some of the carers are older in age, and they do worry for their loved one around what the future holds and what that care and support will look like moving forward. There was issues raised in terms of lack of employment opportunities, volunteering opportunities, and just, a lot of worry within that community. And I just wonder, since that meeting, it does touch on some of the learning disability and physical disability services within the report. And I just wondered what actions have been taken since that meeting and what can be done to answer some of those concerns going forward.
Thank you, Lois. So one of the offers that it was my colleague Linda Kennedy and I that were at the meeting SAP held South Angus Parents for Learning Disabilities, for those that weren't present. And you're right, there is a lot of concern. And I think one of the things that we did say is that we're actually, as a service, very experienced supporting adults to move into the right accommodation for them at the right time when their welfare guardian and when their family say. We do manage as crises when things go wrong. We have got skills and experience within the staff group to do that, and we're encouraging all adults with learning disabilities and their families to make sure that we have anticipatory care plans so that we can start having these conversations about what the future might look like, what you're looking for. We've also put an offer into SAPAL to do a session on transition, so that's a transition for older adults, but we've also, some of the concern was expressed was about young people and what was to happen to young people coming through. And we do work with children and families colleagues already to try and strengthen our transitions work as well. So that's the offer that's been made. The meeting was last Monday. I think that's the key actions that we've taken so far, but we have had discussions just yesterday, Linda and I, around making sure that we are progressing around our supported accommodation work, the respite work, because that was other issues that families raised about what is accommodation, particularly in that part of Angus for people. But we did note that we have actually doubled our supported accommodation offers in the last few years. So we are trying, that's right across Angus, recognising that that there might be other opportunities in the Morayfield-Carnoustie area that we need to explore. I think that was the main things we've done. I'm looking at Linda. Linda's nodding, yes. So that's what we've done so far, and we're more than happy to engage with people. I've also actually just today received an email from one of the families that was there that's looking for more individual support that I will take forward tomorrow. So thank you.
Okay, we're happy to approve the recommendations for the report. Excellent, thank you. And that moves us on to our item 13, communication and engagement update. Jill.
Thank you. So I'm presenting this report on behalf of Sally Wilson, who leads on this work. So this is our communication engagement update paper, and it provides a summary of the communication engagement activities undertaken from October 24 until September 2025. And we continue to work closely with Angus Council, NHS Tayside and Healthcare Improvement Scotland's community and engagement and transformational change teams. This report provides the details of the progress made on delivering the actions within the framework 23 to 26, with further information provided in Appendix 1. Members might note that we have provided the update in a revised format compared to previous years. This new layout is intended to present information more clearly and concisely, making progress and impact easier to identify and understand. I'd like to draw your attention to the key achievements outlined on page 214 of the combined papers. Our podcasts have continued to grow both in scope and audience and provide an alternative way for the public to hear directly from those shaping and delivering services, helping to increase transparency and engagement. And I would really encourage you all to listen to our podcasts. We've also introduced a series of short animated videos to communicate complex information in a clear and engaging way. I think last year it was mentioned about our Facebook page not having the numbers that we would expect for social media, but you'll note this year that we have continued to grow this with a steady increase in followers. This reflects ongoing efforts to provide timely, accessible information about health and social care services, events and public engagement opportunities. Website analytics are also show a steady increase in visitor numbers, indicating greater public interest and awareness. The Angus Council Engage platform is an important part of our community engagement, and we have used it to support consultation and community participation. We've also had coverage on STV on the Angus Carers Academy and the Beacon, which has helped raise awareness of this work. I would also like to acknowledge the work of the Group for Families by Families, a co-produced initiative designed to support families by sharing lived experience, insights and practical guidance for people affected by alcohol and drugs. Their contributions, supported by Angus Alcohol and Drug Partnership, have been invaluable in raising awareness and providing support to others. We started today's meeting with our What Matters to You video and attaches the report and a summary which celebrates the successes of embedding a What Matters to You approach across the partnership and our partner organisations. I'd like to take this opportunity to thank Sally Wilson and Connie Fleming who drive forward this work, and I'm happy to take any questions. Thank you.
Thank you. Any questions, comments? No. Happy to approve the recommendations. You can tell we've hit 5 o'clock now, can't you? Yes, sorry, Lois.
I just think, communication and engagement is really important. I appreciate the work that goes into kind of like the podcasts and videos and things like that. However, I think, the bits of work, certainly over the last few weeks, that I find really powerful is when we go out and engage with, groups, people that have lived experience, parent carers and service users themselves, and hear those stories. And it often is very harrowing and difficult because their experience and interpretation of services can be very different to sometimes what is within a report. And I say that with all due respect to everybody that is working within the services, but it is so important. And then we've heard today a deputation, and what matters to providers that have been with us today, and again, very different to perhaps what maybe is felt within the IJB or the partnership. And I just think it's very important. I don't know whether the providers went away today feeling content and happy with some of the changes made to the recommendations or not. I hope there is some comfort there in some of the changes that have been made, but I do think it's really important that we build on positive relationships. Communication and engagement is really important, and it is good when we hear good news stories. There is a lot of good work goes on every day, a lot of difference is being made, but there is also, as we know, a lot of crisis, a lot of need, a lot of gaps, and a lot of people who aren't maybe feeling as satisfied or as pleased or receiving the service. And I think we really do need to kind of harness all of that in some way moving forward. And I just hope that we can build on, today's deputation and that story, that journey, and look to really ensure that we are really engaging and that we are being open and honest and transparent moving forward. So I hope that will be captured within the next time that we come back, because I think communication engagement is really important. Thank you.
Yeah. No, and I think you make a really good point there, and it's maybe something as we as a committee should maybe think about, is kind of going out and being more visible across the community. Thought you were going to say that you're going to be the next TikTok Angus IJB, and we can all follow you there, Lois. That would be quite good.
Sure, there'll be a few people a bit nervous about that. As to what Lois might go and do tonight on social media, but I do think it would. I don't know how much engagement the podcasts and things get, but I would imagine it's perhaps not. It's maybe a small part of the puzzle, but I don't think it's really cutting it. I know that there was, for example, a community development session in Courtney Golf Hotel last week that was delivered by the communities team within council. I don't know, it would be good to see maybe something similar in terms of health and social care, and really looking to pool everybody together, and so putting that invite out for service users, for families, for workers, bringing people together in a really positive way, to not just talk about the good stuff though, to also hear collectively some of the difficulties and forging a way forward together as to how we tackle some of the big issues that we have.
So I think you're right. I think everything we do is different approaches, because not one thing will suit everybody. But in terms of the podcast, it's actually outlined in the report, the numbers. And Suicide Prevention Week, for example, there was nearly 4,000 listens. So some attract more viewers than others. as you would expect. But it's just one part of what we do. The animations as well as something that we're just growing and developing. And again, that will suit a different set of probably viewers and listeners and whatever. But we are really keen to engage. And you know, we've seen in previous CCPG reports that we've had compliments, and we've also had, you know, a number of complaints. When we do engage with people, we do lessons learned. We have action plans. So we do try and take, you know, we do very seriously take forward concerns that people raise with us, and when things don't go right, we make sure that we learn from that, and we make changes and we develop and we move forward. Thank you. Sorry, Jo.
Yeah, no, just to add, and I think, Lois, absolutely, you can't take away from the personal touch in terms of that communication and engagement. And I think there's a challenge for us all as IJB members around how could we do that different going forward into the next year. So if you have any stories that you would like to bring, then it doesn't always have to be officers that bring them. I think that it would also be helpful if we are going out, then we are going out collectively as an IJB. So representation from yourselves as members of the IJB, we would really welcome that to go out with yourselves, to meet with the community, to meet with staff and services as well.
Yeah, I'd welcome that, Chair. I think it's important that we are visible within our communities, and as I've touched on before, not many people know what the IJB is or the Health and Social Care Partnership. I think it's important we try and make that clear.
Okay, happy to approve the recommendations. Excellent. And that takes us to our final item, the updated annual work plan.
Yeah, thank you, Chair. The report is just for noting, and obviously we've detailed the changes to the annual work plan.
Thanks, Jo. Questions, comments? Nope. Nope. Approve the recommendations per the report. Yeah. Excellent. Thank you. Okay, so that just takes us on to any other business. I've just got one item. I attended the audit committee this morning as an observer, and Sandy presented his 10th and final set of annual accounts for the IJB. Quite an achievement, and probably almost a record holder in Scotland, actually. So just to convey our thanks, Sandy, to all the hard work that goes in over the years to produce that. And we had a wee chat about how much of your life it actually takes up, and how many times you wake up during the night sweating and thinking, did I put the debit and the credit round the right way? So well done, and obviously still got one more audit to go. And finally, the date of the next meeting is Wednesday, the 17th of December. So I shall see you all then. Martin.
Ewan, if you could stop the live stream, please.